Good afternoon. My name is Lydia Motlhale, a professional nurse from South Africa. My study is on strategies to attain and retain community health nurses in the primary healthcare sector. The introduction of the program on community health nurses is a positive move towards healthcare in South Africa, and it has been welcomed by all the parties, all stakeholders, since it's going to address all the shortages of nurses in the public health sector. As South Africa is preparing for the national health insurance, the introduction of these cadres at primary health care will bear a positive fruit. The problem statement is to say, how do we retain the primary healthcare nurses to ensure that the policies that has been implemented on the community health nursing services in the public health sector bear a positive fruit? The research question is, what can be done to ensure that community health services nursing professionals stay in the primary healthcare center on completion of one-year compulsory community services? The research purpose is to develop a framework as a reference for the strategies to attain and retain community service nursing professionals in the primary healthcare services in Gauteng province in Ekurhuleni Health District. The objective of the research is to explore and describe the experiences of the community service nursing professionals working in the primary healthcare setting, to develop a conceptual framework from the results of the experiences of the community service nursing professionals, to develop and describe the strategies derived from the conceptual framework to attain and retain community service nursing professionals in the primary healthcare services. A qualitative, explorative, descriptive, and contextual research design using a phenomenological method to facilitate a systematic naturalistic inquiry was used during the research study. Sampling, a purposive sampling was used. Data was collected through in-depth phenomenological, individual, and focus group interview. Data analysis was through using Georgi and Colanzi stages of descriptive methods of data analysis. Trustworthiness, that is credibility of the study, authenticity, applicability, dependability, and transferability was adhered to. The ethical principles were adhered throughout the study by ensuring that the principles of beneficence, non-maleficence, justice, and respect for all participants were applied. The research came up with 3 to 4 themes as follows. The first theme is working environment. Participants experienced overwhelmed by the number of patients that they were consulting on a daily basis, meaning that the environment was not conducive. There was a challenge of human resource challenges, shortages, physical environment. In theme 2, training and knowledge was a challenge, especially that the participants were exposed to theoretical training. So there was a need for on-site or clinical training, a need for in-service training, a need for exposure to the 3 streams of care. Team 3, the participants experienced lack of support and supervision, where as neophytes in the new nursing profession and in the clinical practice, they needed to be accompanied and to be supervised and supported. Category 4, they were also not content with the placement procedure. As you know that in South Africa, we've got 3 levels of care, that is primary health care, secondary, and tertiary. As they highlighted that some of them, they have applied to be placed at secondary, not primary health care. Hence, that's the reason they were not staying at the primary healthcare services. These are some of the codes which they shared. For example, there were too many patients to be seen. For example, they couldn't cope with the nurse-patient ratio of 60 patients per nurse. They had challenges with the integrated management of childhood illnesses, especially that at primary healthcare level, it's a nurse-based environment. Physical environment, a challenge of infrastructure where there was a lack of privacy, a challenge of lack of resources and equipments. For example, equipments like personal protective equipment, the safety and security. As you know that at primary health care, there would be some challenges with the communities who would attack nurses as and when there are challenges with delayed care, healthcare. Theme 2, training and gaining knowledge. They wanted to be trained on the practical issue. For example, when it comes to expanded program on immunization, they had the theory on EPI. Theirs was to say, how best can we be able to implement this theory into practice? As newly qualified professional nurses, they had limited experience and they needed to be accompanied, especially on primary health care, as I've reiterated, that is a nurse-based environment. Exposure to 3 streams, they needed to be exposed to integration, for example, not to be doing only one stream, which is maternal, child, and women's health, but to also to be able to do the acute and chronic care, and also the other programs. Team 3, lack of support and supervision. They did emphasize that they need to be orientated on the policies, protocols, and procedures for them to be abreast of the new developments and to be able to manage their patients. Some of them, they said, it hurts me. If there are mistakes, they point at me as a ComServe, meaning that as a newly qualified nurse. I don't know why. They always leave me on Friday afternoon to work alone. Those are some of the sentiments which were shared by the participants. Placement procedure, as I have highlighted, that some of them, they would want to be placed as secondary, where there's more support of the multidisciplinary team with the doctors and other members of the team. But in the primary healthcare center, they felt that at primary healthcare, they have to be independent, even if they were not yet efficient. Identification of the central concept. There was a lack of conducive working environment, a lack of training and gaining knowledge, lack of support and supervision, and lack of clarity. And from this concept, there was a need for facilitation of a conducive working environment, facilitation of training and gaining knowledge, of support and supervision of this participant, and also on clarity and proper placement of the participants if they have applied. These are the themes that were identified in the study. Definition of conceptual framework. The conceptual framework was actually based on the Dikoff et al. Elements to determine the agent, the recipient, context, and the terminus, procedure, and the dynamics of the conceptual framework. This is the conceptual framework which was developed, the actual roadmap of the researcher. For example, when you look at the primary agents, we are looking at the National Department of Health, the South African Nursing Council as the primary agents, and the secondary agent is the district management and the primary healthcare professional nurses, and the participants will be the recipients together with the professional nurses who are supposed to supervise them. Our procedure will be facilitation of quality care. And when you look at the dynamic, we find that the dynamics will be experiences of compromised quality care due to lack of the 3 areas of gaining knowledge, support and supervision, conducive environment, and placement procedure. The context is the primary healthcare facilities in the city of Ekurhuleni. And the terminus will be the strategies to attain and retain community service nursing professionals in the primary healthcare. This is a conceptual framework. During the conceptual framework, according to Dikoff et al., we are now looking at the 3 phases. That is the relationship phase, the working phase, the termination phase, so that we must come up with the actual attaining and retaining of our nurses in the primary healthcare services. In conclusion, participants highlighted daunting experiences in the primary healthcare facilities during compulsory community services. Hence, they were not staying in the primary healthcare when they complete the 1-year compulsory community services. The findings will be integrated into relevant literature to provide a thick description of the meaning of the experiences of compulsory community services. It is from this meaning that the conceptual framework from the results of the experiences of the community service nursing professionals have been developed, and the strategies will be presented, which are going to assist in ensuring that we retain and attain the community service nursing professionals in the primary healthcare services on conclusion of the 1-year compulsory community services, in order for the implementation of the policy to benefit the consumers of healthcare services in South Africa. Thank you very much. Tammy.